When dealing with shoulders, it is crucial that you start developing your client's awareness of the brace triangle. And the brace triangle refers to the position of the neck, the position of the shoulders, and the position of the thoracic spine. So you create that triangle, which is a base for them to do all of their movements from. But most clients are stuck here. They're not able to get that mobility and that extension. Even though the thoracic spine has really little extension, we still don't want them to be stuck here. Now, some clients have the ability to actually move the thoracic spine, they're just lazy. But this video is more for clients who feel like they don't have the mobility, and you'll know because you've assessed it. So I've got Carly over here. We're going to start on the BOSU and we're going to build it up to be able to increase that mobility. Her elbows are peripheral vision. She's going to expose her underarm so that she exposes the spine at the back. She's going to inhale, reach over the BOSU, pressing her head into the hands. And then exhale, bring it up so she's mobilizing. The BOSU is soft on the upper back. Watch where she's sitting. She's not too close. I've brought her forward, and this is all about body proportions, how long their torso is. When she goes over, I want her to be able to get her head to the BOSU. So think about your client when you do that. In this position, she's pressing her head into her hands to force that extension and then slowly controlling it back up. And then she's going to inhale, press her head back into her hands, and then slowly controlling it up. And again, pressing her head into her hands. Now you're going to add this. She's going to rotate her spine that way with her head into her hands. 1. She's going to rotate over to me. 2, opposite hip holds back. Rotating that way. This hip holds back. Rotating this way. That hip holds back. 1 more either side. This hip holds back. Rotating that way, that hip holds back, coming into the center and gently lifting it up. Right, so now we take it to the next step. So the surface becomes a little bit harder. We place this in the upper back. Nice. So now because it's a harder surface, it becomes a little bit more uncomfortable because it really presses into the thoracic spine. But this is a low range, so it's not too far. She's going to inhale, release over. You want to find the sweet spot where the thoracic spine feels stuck. When she goes over, press the head into the bed and then exhale, gently bring it up. Inhale, reaching it over. You'll see she shifted to find that tight spot. And exhale, bringing it up. And some clients' tight spots are different. Watch this. As she goes over, she doesn't overarch the lower back, because when she overarches the lower back, she doesn't actually get that thoracic spine mobilizing. It all comes from the bottom. So you want that spine to hold a little bit there and then bringing it up. Now she's going to exhale over. So she inhales, exhale, because now the ribs close and it forces that extension because we're anchoring here and anchoring there and bringing it up. She's going to do 1 more. She anchors here as she exhales with the abdominals closing the ribs, pressing the head in and then slowly bringing it up. And then you can add in that rotation. So she rotates over, hips still, and it's a small movement. It's a bit more uncomfortable because it's not as soft as the BOSU, but she's just trying to hold that position with the opposite hip holding back and gently coming up in the center. And now we take it 1 step further. Now we've got the foam roller, so now the range is going to be bigger. So from here, she's going to inhale over first. So we always do that inhale first because it's a little bit less uncomfortable. Exhale, bringing it up. And again, watching that there isn't an overarch there. All right, so she's holding there with the abdominals. Inhale, releasing it over. Exhale, gently bringing it up. We reverse it. We inhale here. Exhale, we take it over. Anchor, anchor. And then inhale, bringing it up. 1 more. Exhale, anchor, anchor. Hold it. Small rotation if they can. It's really small. 1 because it presses in. Rotating 2. And over, opposite holds 3. Last one, 4. Bring it to the center and gently bring it up. Taking it out, lying on your back. That sets up that upper back to start doing the shoulder work so that we can get into that brace triangle because it has the ability to stay upright. One of the most misunderstood joints is the shoulder. And I'm going to show you a really quick 10-minute routine that you can do to get more mobility in the shoulders, because once we've got the mobility, we're able to glide the scapula. You might have too much mobility, because we get that a lot. And if you have too much mobility, it means that we're going to work you in mid-range and not do shoulder mobility. But that's for a later video. Check this out. Two areas you want to test is pec major and pec minor, because that's going to tell me whether the client is going to be stuck in this position. If the shoulder rolls forward because pec minor is tight, they're not able to open it out and expose the underarm. So this is the pec minor test. She's going to take her arms up to 90 degrees. She's going to open the arms out, but here's the trick. The elbows have to pull away and the hands have to try and be lower than the elbows. When I get the hands lower than the elbows, it's going to tell me whether that pec minor has the flexibility to do that. If she can get the hands lower than the elbows, it exposes the underarms. And that tells me that serratus anterior is able to take that inferior angle of the scapula and expose the underarm. And we need that for scapular stability when we start loading the shoulder. So this is the first test, is how flexible or tight is the pec minor. Then we've got the pec major. So she's going to take her arms directly out to the side, longest route, not straight elbows. I want you to bend her elbows and hang them down on the floor. So I want that chest to open completely, because this is going to tell me whether her thoracic spine is going to be stuck when I'm trying to do shoulder work, because if the thoracic spine is stuck, she also can't open the chest out and get the arm into its full range. So I want to see that the elbows are relaxed on the mat. So those are my two quick tests. Then I do mobility. So she's going to start with bent elbows. She's gently going to open it out, hands down, lower than the elbows, bring it back in. And opening it out, it is free, and bringing it in, there's no effort. And open, reach the elbows away and bringing it back in. And now what you don't want them to do is, as they open, if they tell you they're feeling it in between their shoulder blades, then you know they are squeezing the shoulder blades together. The stretch should be over the front of the chest. Here's the thing, if they're not getting a stretch, but they're squeezing the shoulder blades, it could actually be the structure of their shoulder that is a little bit different. So now she's going to bring her arms up, straighten her arms, palms turned to face her knees. Inhale, arms above her head. This is what I'm looking for. Exposed underarms, hands dropping naturally to the floor without an arch happening in the back, because that's going to make them think like they went further when they didn't. Circling it all the way around, keeping the wrists light on the floor. Inhale, floating it up. Exhale, circling it around. And inhale, floating it up, exposed underarms. Exhale, circling it around, no arching the back. One more, inhale, floating it up. And exhale, circling it around. She's now going to float it up, down on the floor, bend the elbows in at the sides and straighten the arms. So I'm going between pec major and minor, taking it up, bending it in at the sides onto the floor as soon as she can, bringing it next to her sides and taking it all the way up. Last one, bending it in next to the sides and all the way over. From there, bringing it up to the ceiling, crossing the elbows over, holding the opposite shoulder blade. So we're now pulling the shoulders apart at the back just to release in between the shoulder blades. She's then going to bring her arms up, interlace her hands, elbows touch each other, but they are going to separate. She inhales, takes the arms above, Exhale brings it back and gets the elbows touching. So we're pulling the shoulder blades apart. And inhale, taking it up. And bringing it back and getting the elbows to touch as soon as possible. And last one, taking it up. And gently bringing it back, holding it there. Just relax it open. And release it. And this is just a mobility routine that we do. It's supposed to be free. We're not forcing the movement. We're trying to open the scapula at the back, create big circles, heavy arms, and that's going to start giving us the range that we need to be able to get that beautiful outward rotation of the scapula. How do you get your clients or you to find the serratus anterior, which actually comes from the medial border of the scapula, wraps all the way around the chest to come over here like fingers. And it's a muscle that nobody knows what it feels like when it's working, because it's kind of one of those that doesn't fatigue so that you feel it like a bicep or a tricep. So we've got to find methods to get our clients to be able to activate it, because it's one of the most important scapular stabilizers, and it creates the outward rotation of the scapula so that this doesn't happen. It actually opens it like that. So I've got Carly over here, and I'm going to show you a few ways that you can wake up the serratus anterior. The first thing you've probably seen before, but it is how it is done that is crucial. So she's going to put these two in her hands. It's 4 kilograms. So you can increase the weight if you want to. She's going to start with her elbows down. So we're just resting it there. It's not working at all. From there, I want her to reach her arms up, but she's going to drop her shoulder blades on the foam roller. Now the serratus is not working. In fact, it's stretching because the two medial borders are coming together like that, and the serratus actually does that. Now she's going to reach her arms up to the ceiling, but she's not going to overdo it, because when she overdoes it, she goes a lot into pecs and too little into serratus. So I want to find that middle line. So she's going to bring it down just a little bit, reach up a little bit more. That's where I want it. That's that sweet spot of the serratus. And then she can lower the shoulder blades back down. And she's going to take it up to that sweet spot. So we call this open chain, and controlling it down and bringing it up. And this is how we wake it up. But as she does that, I want her to feel like there is a scoop of the blade, and the hands almost tilt that way rather than pressing up and coming to me. So it's a scoop of the blade with a gentle reach that way with the weights, and then controlling it down. So that's method number one. Let's go to the next one. Second exercise. Here are the cues, all right? So she's on her elbows. It's a little bit easier to wake up serratus. I want her elbows just a little bit more forward, all right? She's gonna take her elbows and drive it through the bed. So she's really pressing through without flexing over there. I want you to press through and open the chest, because the position of the thoracic spine is crucial. She's maintaining abdominals just so we don't get a big arch here, because when she arches there, she's going to want to drop there and then she's going to lose serratus. We keep this, we open here, and we press the elbows through so that we can find the serratus. This is just the beginning. Now she's going to hover her knees just off. There. Over here, she's exposing the underarms. And when she exposes the underarms, she says, hello, serratus anterior. She's now loading the serratus anterior in what we call its concentric state, but it's still not maximum concentric, but it's concentric. And then she's going to lower it down. So you can do a few of those. Now we increase the load. We want to make it more challenging for the serratus. So she's going to hover just off. She's now going to bring her torso forward. This is where it's challenging. She's going to want to wing or poke, but she's not. And then she's going to bring it back. There, the serratus likes this position because it works here. But it struggles with this position. So she's lifting her chest away, lifting her chest away, lifting her chest away, and then bringing it back, opening her chest, driving the elbows through. Bringing it forward, lifting her chest away, lifting it away, lifting it away. and bringing it back, opening her chest out and lowering it down. 3 simple ways to start activating the serratus anterior to get that connection to the inferior angle of the scapula and start stabilizing the shoulders better. You know how everybody always uses this for shoulders, especially when they're training the rotator cuff. What if I told you that this is not your first step? In fact, you're not going to use this until they get certain things right. So the rotator cuff is always taught with resistance. And I want to tell you that most people can't even do it without resistance. So why are we giving them bands and weights? We want to teach the client to connect to the inferior angle of the scapula. There it is. You can see she can connect to it. Now, hardly anybody can do this. But once you get them to connect to that inferior angle, it's like there is a mind explosion because they connect to a bone that they cannot see that's on the back of the rib cage. And when I've taught professional sports individuals to connect to that inferior angle, they've told me time and time again, it is a game changer. So normally we have a client pulling a band to strengthen the rotator cuff, and this is what it looks like. All right? We don't want that because we're not getting true lateral rotation in the shoulder. That is a fake set of rotation happening there because all she's doing is retracting the scapula, and the hands think that they went further, and the brain is going, wow, my lateral rotation is phenomenal. But I want to get her to dissociate there in the shoulder, which means she's going to relax the inferior angle down, and she's going to open. I'm going to ask her to lower her hands slightly, and where her elbows are is like a pivot point. So I always teach the client that this is your pivot point, but there's a trick. It's not back here, because look there. It's not there. That doesn't make any sense. There is a sweet spot. It's almost like just in front of your waist. And I keep my hands there. She rotates out, and as she rotates out, I kind of press the elbow a little bit forward, right? So her hand is going back and her elbow is going forward. Now they get that beautiful outward rotation of the scapula, and then she just pivots it back into the center. But your client cannot do that without a band, so why are we giving it to them with a band? So we get rid of it. We have her palms facing up, and we teach the client that this is a free movement. It's completely relaxed. Now, if you look carefully, you'll see that her left shoulder blade works differently to her right one. She wants to let that one go. So I'm going to ask her to find that inferior angle and find the sweet spot of opening it out. So you'll see she's overdone that one and underdone that one. There we go. That looks good. So she's going to bring it in, rotate. And now this is held. The work is inside the actual glenohumeral joint. Once I can get the client to do that and then maintain this, get that outward rotation as they take their arms out, and then bring it back down to that position so it comes back in, that's important. She takes it out again, rotate, reaches it out, hold that. There's the inferior angle. I want the client to be aware of that. As she takes the arms up, I want you to take it all the way up. That inferior angle is going to travel more laterally on the rib cage. The client must know that it's sitting there. Reach your arms out to the side and then slowly bringing it back in and rotating it in. What you want to be able to do is get your client to connect to the inferior angle of the scapula to be able to do free movement inside the shoulder socket without all these weird things happening in the shoulders. It's supposed to be free and relaxed instead of this. Because if you've got those bad mechanics and you then start adding a band, you start strengthening it with bad mechanics. And that makes no sense. So free movement is the main goal when you start any rotator cuff or shoulder training. And if you love biomechanics and you want to dive even deeper into the shoulder, I'm going to tell you, you've simply got to subscribe. You've got to go look at the pinned comment here, because there is our shoulder training, and check out this next video. As simple as that.